Hello and welcome to Pregnancy Info. Today we will discuss about the problem in pregnancy in all over the women during their any part of life. It is called Leukorrhea. In simple word, it is called vaginal discharge. So what is vaginal discharge? Normally, this discharge is clear or white. It may become stretchy and slippery during ovulation. About 2 weeks after your menstruation period, a change in the color or amount of discharge, accompanied by other symptoms, may indicate that you have an infection called Leukorrhea. The vagina normally contains bacteria. Bacteria growth is controlled and affected by many different factors, such as acid level, pH, and hormones. Anything that upsets this balance may increase your risk of infection or overgrowth of any of the normal bacteria or by yeast. Now we will discuss the way of diagnosis. White blood cells under a microscope when examine vaginal fluid. Vaginal fluid is normal and cause of change in discharge during infection, malignancy, and hormonal changes. It sometimes occurs before an adolescent female has her first period and is considered a sign of puberty. Your doctor will ask a variety of questions to help point out the cause of your discharge, including questions about recent antibiotic use, whether you have a new sexual partner, menopause symptoms, diabetes symptoms, and other recent changes in your health or lifestyle. You will then have a pelvic exam. Your doctor will use a device called a speculum to look at the cervix directly. During the cervix or pelvic exam, a sample of the discharge is collected for testing. By looking at the discharge under a microscope in the office, your doctor can diagnose yeast infection, bacterial vaginosis, or trichomoniasis infection right away and start treatment. Based on the appearance of the vaginal walls, your doctor may make a diagnosis of atrophic vaginitis. Your doctor will check the tenderness of your cervix, uterus, or ovaries by placing his or her fingers inside your vagina. Tenderness may indicate that you have a sexually transmitted disease or pelvic inflammatory disease. Diagnosis, gonorrhea and chlamydia, require the result of laboratory tests which may take a few days. Now we will discuss the types of Leukorrhea. Simply, it has 3 types. Number 1. Physiologic Leukorrhea. It is not a major issue, but it is to be resolved as soon as possible. It can be a natural defense mechanism that the vagina uses to maintain its chemical balance, as well as to preserve the flexibility of the vaginal tissue. The term physiologic Leukorrhea is used to refer to Leukorrhea due to estrogen stimulation. Leukorrhea may occur normally during pregnancy. This is caused by increased blood flow to the vagina. Due to increased estrogen, female infants may have Leukorrhea for a short time after birth due to their uterine exposure to estrogen. Number 2. Inflammatory Leukorrhea. It may also result from inflammation or congestion of the vaginal mucosa. In cases where it is a yellowish or gives off an odor, a doctor should be consulted since it could be a sign of several diseases processes, including an organic bacterial infection or STD. After delivery, Leukorrhea accompanied by backache and foul-smelling lochia mean postpartum vaginal discharge containing blood, mucus, and placental tissue may suggest the failure of involution, the uterus returning to pre-pregnancy size due to infection. A number of the investigations such as wet smear, gram stain, culture, pap smear, and biopsy are suggested to diagnose the condition. Parasitic Leukorrhea. Leukorrhea is also caused by trichomonads, a group of parasitic protozoan, especially Trichomonas vaginalis. Commonly, symptoms of these diseases are burning sensation, itching, and discharge of frothy substance, thick, white, or yellow mucus. Treatment. Leukorrhea may be caused by sexually transmitted diseases, therefore treated the STD with the help of tests, and the medicines include antibiotics such as metronidazole and other common antibiotics such as clindamycin or tinidazole. Some causes are described in this video also so that you can understand the problem and what are the causes. Number 1. Use of antibiotic. Continuous use of antibiotic can cause the harm to your essential bacteria in your vagina. Due to the loss of such bacteria, you may cause Leukorrhea. Birth control pills also can change the hormonal setup and so you can cause Leukorrhea. Douching is also a major cause of Leukorrhea, so don't rub your lower part with any hard thing or try to tap it slowly. Diabetes is also a major cause of Leukorrhea because the increased number of sugar is the cause of increased yeast production. Pregnancy is the common cause of Leukorrhea because during pregnancy estrogen level is increased and it causes Leukorrhea. Stress is the cause of almost all the diseases, so it can also lead to Leukorrhea. Tight or synthetic undergarments like underwear, so this may also cause this problem. Vaginal discharge may result from infections with yeast, also called candida, a type of fungi that is part of the normal flora of human skin but can also cause infections. Gardnerella, a type of bacteria found normally in the female genital tract. This is the cause of bacterial vaginosis. Trichomonas, a type of protozoa, an organism made up of a single cell, is also cause of Leukorrhea. Prevention. Your doctor can work with you, identify whatever lead to your symptoms such as antibiotic use, wearing non-cotton underwear, wearing tight-fitting undergarments during exercise, using scented products that irritate the vaginal lining, or using birth control pills. If you use birth control pills, you may not need to stop using them to prevent recurrent infection. Changing the type or the strength of the hormone in the pills may be enough to stop symptoms from returning. If you are diabetic, controlling blood sugar levels may help to avoid recurrent infections, especially yeast infection. Some home remedies are also described in this video. Number 1. You should eat as much as you can the fresh tomatoes. You can use them in the form of salad. You may also take the unripe banana and make it as a vegetable. Use 8 grams of oil or ghee in hindi and also mix the banana in it and use this about 10 days, day and night. It will cure this problem. You may use cumin seeds and mix it with sugar and eat it. It may also help to control this problem. Another remedy is about the banana. You may eat banana and after eating you may drink milk. The both in a combination help to reduce the infection. Hope you have understand all the symptoms, treatment and causes of Leukorrhea. If you like this video, share it with your friend and family members and also with the friends who are pregnant and who need this video to watch. And also subscribe my channel to encourage me. Thank you.